Imagine preparing for one of the most joyful moments in life, welcoming a baby, only to find out that something unexpected is putting both you and your baby at risk. You feel fine, but a routine test reveals high blood sugar. You've never had diabetes before, so what's going on? This is the reality many women face when diagnosed with gestational diabetes. Gestational diabetes is a condition that can occur during pregnancy, typically around the 24th to 28th week. It happens when the body can't make enough insulin to keep up with the increased needs of pregnancy, leading to higher than normal blood sugar levels. While this condition usually goes away after the baby is born, it's important to manage it carefully to keep both mother and baby healthy. Who is at risk? Now, who is more likely to develop gestational diabetes? Some common risk factors include being overweight before pregnancy, having a family history of type 2 diabetes, or having had gestational diabetes in a previous pregnancy. Women over the age of 25 or those with conditions like polycystic ovary syndrome may also be at higher risk. Symptoms. In many cases, gestational diabetes doesn't cause any obvious symptoms, which is why it's often called a silent condition during pregnancy. Some women might notice feeling more thirsty than usual, becoming unusually tired, or needing to urinate more often. These signs, however, can easily be mistaken for normal pregnancy symptoms. This makes routine prenatal screening incredibly important, as it helps detect gestational diabetes even when no clear symptoms are present. Early detection can play a vital role in preventing complications and ensuring a healthy pregnancy journey. Diagnosis. So how is it diagnosed? Most women undergo a glucose screening test between the 24th and 28th weeks of pregnancy. Here's how the process usually works. Step 1. Glucose screening test. You'll be asked to drink a sweet, glucose-rich liquid. About an hour later, a blood sample is taken to check how your body processed the sugar. Step 2. If needed, glucose tolerance test. If your initial test results are higher than normal, your doctor may schedule a more detailed test. In this one, you fast overnight, then drink another sugary solution. Your blood sugar is then tested several times over a few hours. These tests help determine how your body responds to sugar and whether you need further care or monitoring during your pregnancy. Risks and complications. Let's talk about the risks. When not managed properly, gestational diabetes can lead to complications. For babies, this can mean a higher birth weight, breathing difficulties after birth, or an increased risk of obesity or diabetes later in life. For mothers, it can raise the risk of high blood pressure, cesarean delivery, and future type 2 diabetes. Managing gestational diabetes. The good news is that gestational diabetes can be managed very effectively. One of the first steps is adopting a healthy eating plan. Focus on whole grains, fresh vegetables, lean proteins, and healthy fats, while avoiding sugary foods and drinks. Eating smaller meals more frequently can also help keep your blood sugar levels stable. Physical activity. Physical activity is another helpful tool in managing gestational diabetes. It not only helps regulate blood sugar levels, but also supports healthy weight gain and reduces the risk of complications during delivery. Here are some recommended forms of safe and effective physical activity during pregnancy. Walking. A simple and low-impact exercise that can be done almost anywhere. A 20 to 30-minute brisk walk daily can make a difference. Swimming. Gentle on the joints and helps reduce swelling while offering a full-body workout. Prenatal yoga. Enhances flexibility, improves posture, and promotes relaxation while strengthening the body. Stationary cycling. A safe indoor option that improves cardiovascular health without stressing the joints. Engaging in regular exercise improves how your body uses insulin, lowers blood sugar, and boosts energy levels. Always check with your doctor before starting any new exercise routine during pregnancy to ensure it's appropriate for your specific condition and health status. Monitoring blood sugar. Monitoring your blood sugar levels regularly is also important. Your doctor may recommend checking your levels several times a day. This helps you stay on track and adjust your routine if needed. Medication support. In some cases, diet and exercise may not be enough. If that happens, your doctor may prescribe insulin or other medications to help manage your blood sugar safely. After delivery. After your baby is born, gestational diabetes usually goes away. But it's important to remember that having it once increases your risk of developing type 2 diabetes in the future. That's why follow-up care is essential. Your doctor will likely test your blood sugar 6 to 12 weeks after delivery and recommend regular testing every few years. At last, gestational diabetes is a manageable condition. With the right care, attention, and support, you can have a healthy pregnancy and a healthy baby. If you have any questions, feel free to leave a comment below. We'll be happy to answer and support you on your journey.